Hello there, welcome to your eye examination. We have lots of tests to perform to build a comprehensive ocular profile, and I'm also going to be taking dictations of all the findings this evening. So if you're ready, let's start with your vision. Cover your left eye with the palm of the hand. From left to right, I'd like you to read down to the smallest row possible there. Okay, cover the other eye, going from right to left. Read the smallest row there. Okay, that's the reduced Snellen. Let's move on to a near vision chart. Again, cover the left eye, going from left to right. Please read the smallest block of letters you can. Cover the other eye, from right to left. Read the smallest block. I'm liking the vision there. Okay, I'm just going to perform a cover test, so just looking towards me, please. And just from side to side. For the near vision cover test, I'd like you to look towards the groovy flower target there. And just from side to side, keep looking at the groovy flower, please. Dictation time, just bear with me. Reduced Snellen vision 6/9 plus, right and left. Stycar near vision chart N6, right and left. Cover test distance, no movement detected. Cover test near, small exophoria, estimated 4 prism diopters. Quick recovery. I have a ruler here, which I'm just going to rest against the forehead, very gently. Just look towards me. And this eye, this eye, this eye. Okay, and for near, look towards the dog with the ball there, please. Okay, I'm going to use this scale to check your pupil sizes. Just look towards me, please. Okay, looking towards me. Now looking towards the B. Back to me. looking at the groovy flower. Back to me, and look once more at the flower. Okay, looking towards me, we are going to check the pupil reactions to light. Keep looking at me. Okay, that completes that set. Pupillary distance. For distance, 66 millimeters. PD for near distance, 63 millimeters. Pupil sizes in good artificial lighting are 5 millimeters, right and left. Pupils equally round and responsive to light, direct, consensual and near present, right and left. No relative afferent pupillary defects detected. Okay, I'm going to check your colour vision now. I'm going to do this with both eyes open. I'm going to show you some plates with some numbers. Some may not have numbers, but if you see a number, just say what it is. Please go from left to right. I'll give you approximately 3 seconds per plate. Okay, keep going, please. Thank you. That's correct. Okay, slightly different on these plates, say the numbers. We have your final set here. That concludes the Ishihara colour vision test. Okay, let's move on to ocular motility. We are essentially checking your eye movements. So So if we find a suitable target, okay, keep your head very still for this test, follow only with the eyes. This is your target in question. The child with the umbrella, please. Okay, and to keep things interesting, just look towards the cat there. Okay, once more along the horizontal. Good. Binocular Ishihara test is a pass. Ocular motility, full and smooth movements. Okay, we have a monocular test here. Okay, it's just a little chart with some letters on, with a progressive reduction in contrast. I'd like to cover your left eye and say the letters on the chart as far down as you can, please. Okay, is that your limit? Okay, any more possible? Okay, cover the other eye. This time reading from right to left. Read down as far as you can on the contrast chart, please. Okay, can you go any further? Thank you. That's the contrast sensitivity test. Okay, let's move on to a little visual field test. This is the red dot perimetry chart. It's important that as you're performing this test, you're looking at the central black spot. Cover your left eye. This is monocular. Okay, can you see the black spot? Okay, keep your eyes on the spot. Now, as you're looking at the spot, are all 8 red dots present? And are any parts of the red dots missing? And would you say the red dots are all equally red? Okay, cover the other eye. Same thing, keep looking at the black spot. Okay, are all dots present? Any parts of the red dots missing? All equally red? Okay, a very simple test there. Okay, we're going to move on to convergence. I'm going to ask you to look towards the face of the teddy bear, follow it towards the nose. If the teddy bear's face splits into 2, horizontally or vertically, please inform me. Okay, are you ready? Look towards the face of the dog there, same thing, follow. follow. Okay, any double vision? Okay, let's take some notes. Pelly-Robson contrast sensitivity test. Normal, right and left. Red dot perimetry test, right and left, is full. And convergence, approximately 3 centimetres from nose until left eye shows divergence. No reported diplopia. Okay, we're going to check your saccades now. Simple test, just looking from one point to another. Okay, I have these model thumbs. I'm going to be illuminating one, asking you to look between the two. So head steady. Okay, look towards the illuminated thumb. And the other one. Back to the red thumb. And the other one. And once more to the illuminated. We are now going to perform the Amsler test, another monocular individual test. So cover your left eye with the palm of your hand. I'm going to show you a grid with a white spot in the centre. You must keep looking at the spot through the whole of the test. Okay, now as you're looking at the white spot, are there any distortion to the lines? Can you see all 4 corners of the grid? Are there any missing parts on the grid? Okay, cover the other eye please. Same again. Keep looking at the central spot. Okay, do you see all 4 corners of the grid? Any distortion? Any missing parts on the grid? Okay, let me just repeat this test using a slightly different form of the Amsler. Okay, keep looking at the spot again. Okay, any distortion to the lines? No other anomalies, good. And finally cover the other eye. Again, looking at the central red spot. Any distortion? Anything unusual going on there? Excellent work. I'm quite satisfied thus far. Okay, before looking inside your eyes, I'm going to just take some vital measurements in case of new spectacles. So just keep looking towards me, please. Or straight ahead if this blocks your sight. good. We'll take the notes here. Saccade's normal. Amsler, normal, right and left. No reported distortion or scotomas. Facial measurements include an apical radius of 6 mm, frontal angle of 20 degrees right and left, splay angle approximately 25 degrees right and left. We have a negative bridge projection. Okay, let's move on to ocular health and just looking at the back of the eyes. Okay, this is the ophthalmoscope for looking through your eye. So your job is to just look off at the wall in the distance, please. Okay, cornea grossly clear. Crystalline lens looking clear. Lids and lashes will check on the slit lamp. Okay, just approaching through the vitreous, focusing on the optic nerve. And just the mid-peripheral zones there. And looking into the light now, please. Macular review there. And for peripheral views, just looking up to the ceiling. Now to your right hand side. And the left side. Okay, looking down to the floor. Okay, look off into the distance again. Blood vessels and the mid-peripheral nerve fibres. Okay, for your left eye, looking at the wall, please. Cornea, lens, limbal area, vitreous humour, optic nerve, mid-peripheral zones. Looking into the light, macular review there. Okay, look off to your right. Look to your left. The temporal periphery. Okay, up to the ceiling. Down to the floor. And I'll switch to the red free filter. look off into the distance again. Thank you. External areas grossly clear, clear crystalline lens, a few fine vitreous floaters, right and left, optic nerve head, pink and defined, CD 0.5, right and left, no signs of any notching, bayoneting, flyover vessels or PPA, macula appears flat, right and left, with a bright foveal light reflex. Vessels 2 to 3, no signs of any nipping or tortuosity. Peripheries clear, flat and intact. Okay, let's have a look at your eyes with the retinoscope and some lenses. Okay, just looking off over my shoulder, I'm just going to have a look with some lenses now. Just having a little look at what your prescription may be. Okay, and your left eye. Looking off into the distance, please. Okay, just sweeping the lines. Okay, let's try one more lens. Okay, I'm finding a planar prescription there. That concludes retinoscopy. Let's move on to eye pressures and slit lamp ocular health examination. So this machine is the slit lamp. It's going to allow us to take some external ocular health assessments, as well as just looking at the anterior lens through to the posterior lens surface. So it's just a light. I'd ask you to look towards this here. Okay, just checking the lids and lashes. Okay, just look down for me, please. Okay, and looking up, lower lid margin. Okay, look straight ahead. Look up again. right and to your left. Okay, and just looking at the limbal area now. Completed sclera and conjunctiva. Okay, just a little cross section of the cornea now. Looking straight. Okay, let's have a look in the anterior chamber. Okay, keep looking towards my ear, checking for any activity. Excellent. And let's check the anterior angle. 60 degrees on the temporal side. Grade 4, excellent. Let's have a look on the nasal side. Nasal angle, approximately grade 4. Looking at the iris surface. Okay, I'm going to make it very bright now. Bring the beam down. Okay, no signs of any iris trans-illumination. Just checking the anterior lens surface there. Cross-sectional view. Grade 0 for cataract. Good. Okay, let's move on to your left eye. Okay, try and look towards the picture, the background, or in that direction to start. Okay, lower lid margin. Now just look up. Okay, look down to the floor, please. Okay, look off into the distance again. Just have a little sweep of the sclera. Okay, look up to the ceiling, please. Limbal zone. Quiet, looking down to the floor, please. Conjunctiva and limbus quiet. Okay, I'm just going to scan the cornea. No deposits. Just the iris now for any transillumination. It's going to be quite bright. Eye wide open, please. Okay, no transillumination. Just the nasal iris. Signs of any pseudo-exfoliation. Okay, and a look at the crystalline lens. Just a cross-sectional view. Okay, I'm just going to bring the angle to 60 there. There we go, keep looking straight ahead, just checking the anterior angle. Good, and on the left nasal side. That is grade 4 again, lovely, looking straight ahead. Just have a look for any activity in the anterior chamber. Okay, just keep looking straight. Okay, no signs of any cells or flare in the anterior chamber. Excellent, no ocular redness. Okay, please sit back for me. That concludes slit lamp. Just take some dictations. Lids and lashes clear, right and left. No signs of trichiosis, pauliosis or madarosis. No evidence of blepharitis. Certainly no lumps or bumps such as chalazion or hordeolens. Scleral and conjunctival surface clear and quiet, including the limbus right and left. Anterior angles right and left, grade 4 nasally and temporally. Iris surface clear and flat. No AC activity. No signs of any pseudo-exfoliation. Crystalline lens clear right and left. Okay, your final test involves me popping some drops in your eyes and just checking your intraocular pressures. I'm going to use the Perkins method. Now this involves popping a drop of anaesthetic into the eyes, which just stings ever so slightly. It goes fast. So let me get the drop ready for you. It's also a little bit yellow. So if you could look up to the ceiling, lower the lid, place one drop in the lower part there. And look up again for the left. Give that a few seconds. And I'm just going to dab around the lid margins there. Just to mop up a little bit of excess of the drops. Okay, is the stinking wearing off there? Okay, so this is the Perkins tonometer. This probe will gently touch the corneal surface. Last but a few seconds. As it's resting against your eye, I'm going to be checking the pressure by just turning the wheel. So your job is to keep both eyes open, breathe normally, and keep looking at one point off into the distance. Okay, if you're ready. Okay, quick and easy test. We're looking at 19 mil of mercury on the left, on the right. And for the left, looking to the distance at one point. We have 18 mil of mercury there. Okay, let's take the final notes. Perkins stenometry performed at 6 p.m. Right measuring 19 mil of mercury, left 18. Drops used: lidocaine hydrochloride, expiry date 06/2005. Okay, so that concludes your ocular examination. Looking healthy, no spectacles required. I'm going to put you on a 2-year recall. Please come back if there are any ocular problems and we'll try and book you in at the time. So that's everything. Thank you and goodbye.